Good afternoon, everyone, and thank you for joining us today. We are waiting for others to join, so we'll start shortly. Just give us a few seconds. We will start. Do see that many of you are joining, so thank you for your patience. I'm so happy to see that so many people are interested, and so we're still waiting for others to join. Okay. Yeah, just want to give everyone a chance to join. Okay, are still joining. Okay, I think, all right, so I think we could start now. Um, so we will start and hopefully everyone that wants to join will be able to. So we can go to the next slide. Thank you so much. All right, so my name is Lucia Leone, and I am the Senior Benefits Manager for Benefits. And I am joined today by members of the CU Benefits team, my colleagues Angela Chen, who is our Assistant Director for Benefits. Um, we also have Carla Rivera, who is our Assistant Director for Tuition. Hi, Carla. Deborah Ridgard, who is our Benefits Program Specialist for Retirement. And has Lauren joined? Don't see Lauren. Um, and then we also have Sarah Loop, who is our Executive Director for Benefits. Uh, today's uh, today's session is designed to assist you with making the best choices for 2026 for yourself and your family. We will provide information about where you can obtain resources during open enrollment, important contact information, and highlight new benefit offerings. If you have any questions during the presentation, please use the chat feature to submit your questions. We will answer them during the presentation on the chat, or we can answer them at the end of this presentation. Next, please. So, as you probably already know, since you've, I think, received a benefits brochure, open enrollment will begin Monday, November 10th, and we'll go through Friday, November 21st. Open enrollment materials were mailed out mid mid-October, so you should definitely have them at hand. But if you don't, you can go to our open enrollment website, humanresources.columbia.edu/OE, and you can link to the brochure. You could also call the Columbia Benefit Service Center, which is a great source. We are available Monday through Friday from 9 to 5. So please call us at 212-851-7000 or contact us through email hrbenefits@columbia.edu. So where are you enrolling? You can go back. So where are you enrolling? So you're continuing to enroll through Columbia University Benefit Service enrollment system, which is known as CUBES. It's a new and improved CUBES. I think some of you may have already used cubes before attending this session. Please, while you're in cubes, please consider opting into the electronic document delivery of legally required notifications. And also keep in mind that the changes that you're making during open enrollment will remain in effect until the end of the calendar year, unless you have a qualified life status change. Next, please. So as in previous years, this is a passive open enrollment. This means that you're not required to take any action to keep most of your current 2025 benefits, but there are certain exceptions that we will discuss on the slide. So we strongly encourage you to take this time to review your current benefits. Visit open enrollment website specifically designed for open enrollment. Attend a benefit expo, and of course, contact our dedicated benefit service center representatives. We are all here to help you. So what happens if you decide not to take action? If you do not decide to take action, your current benefits, which are your medical, dental, optional vision, transit and parking, life insurances, accident, death, and dismemberment, identity theft, optional long-term disability, and involuntary benefits will roll over to the following year. With the exception of the benefits that you see on the right-hand side, which are the healthcare flexible spending accounts, dependent care flexible spending account, child care benefit, and health savings account. These contributions that you're making for 2025 will essentially expire at the end of the year. So that means that you would need to make new elections during open enrollment um, for 2026. So please remember to go in to make your elections. You would also be ineligible to newly enroll in accident insurance, specified disease insurance, which was formerly known as critical illness, hospital indemnity insurance, and MetLife legal plan. Next, please. So now we're going to talk about the 2026 changes. So what's new for 2026? Okay, the first one is the long-term disability. Long-term disability insurance can help replace your income if you become ill or injured and unable to work. And Columbia automatically provides basic coverage at no cost to you. You also can choose to enroll in the buy-up, also known as optional long-term disability. That increases the salary replacement amount that you receive and includes a 3% cost of living adjustment. We have made some enhancements to the optional long-term disability. The salary replacement that you receive while on long-term disability will now remain at 66 and 2/3 of your annual salary up to $15,000 a month for the duration of your disability. So previously, the benefit was reduced to 60% of your annual salary up to $15,000 a month after being on LTD for 6 months. In addition, during a special one-time open enrollment opportunity, you do not and if you opportunity if you do not currently have long-term disability, or if you were previously denied long-term disability, you can you will be able to elect long-term disability during this open enrollment without having to provide evidence of good health. The next benefit is that we're enhancing is the life insurance plan. The life insurance can help you provide financial protection for your loved ones in form of a lump sum benefit to your designated beneficiaries in the event of your death. Currently, eligible employees are covered with 1 times their annual salary up to $50,000 at no cost. So you also have the option to elect additional life insurance, which normally requires completing evidence of good health. However, during open enrollment, you will be able to enroll or increase your existing life insurance coverage up to 3 times your annual salary to 1 million without evidence of good health. In addition, there would be reduced rates for both optional life insurance and accidental death and dismemberment insurance for you and your dependents. And we would like to take this opportunity to remind you about your beneficiary designations to life insurance. To be sure that your benefits are in place, we encourage you to review your beneficiaries for life insurance housed in cubes. The next change is to retirement under the Secure Act 2.0, an important retirement plan update. So if you are turning age 50 anytime during 2026 and have earned at least 145,000 by December 31st of 2025 and want to make catch-up contributions to the voluntary retirement savings plan, the contributions must be made on a Roth post-tax basis. The pre-tax basis is no longer available to you. Next, please. Tuition. So for tuition programs, we have made the application process paperless. This means you are now able to submit your application for both college tuition scholarship, which is CTS, and primary tuition scholarship, PTS, making it faster and easier to manage. Your voluntary benefits. There has been a change to the carrier. So your voluntary benefits, which include accident, specified disease, and hospital indemnity, are currently under MetLife. The new vendor in 2026 will be New York Life. So if you are already enrolled in one of these plans, you do not need to take any action. Your coverage will automatically be transferred to New York Life. And then the next one is bereavement support, which we'll be talking more. We'll highlight this later on in our presentation. So New York Life is introducing bereavement support resources through empathy and through survivor support. These programs offer compassionate guidance and practical tools for you and your family during times of loss. Everything from emotional support to help with estate and claims processes. We will discuss this benefit, as I said, more in detail in an upcoming slide. Next, please. So we'll just like to give you a summary of the new IRS regulations for their pre-tax contribution limits. So the health savings account, with this health savings account, you can now contribute an additional 4,400, well, it's not an additional, it's an additional 100. It's going to go up from 43 to 4,400 if you have single coverage. Family coverage, it will be increasing to 8,750. In addition to that, the health, the in addition to that, we have the health flexible spending account and the yearly contributions that you can make to the healthcare flexible spending account will increase the pre-tax contributions you make to help with out-of-pocket expenses that the medical, dental, vision plans do not pay from 3,300 to 3,400, and any unused funds that can be carried over have increased from 660 to 680 into 2027. Dependent care flexible spending account. Contributions into the dependent care flexible spending account have also increased from 5,000 to 7,500. For this account, you can use for expenses such as summer day camps, qualified child and adult care centers, nursery schools, preschools, school and before school and after school programs. And then finally, the transit parking. This has also increased, which is great, from 315 to 340. And these funds can help you pay for travel expenses and parking expenses, or both, to and from work. Okay, now I'm going to turn it over to Angela Chen to continue our presentation.
Thank you, Lucia. We would now like to
Sure.
shift gears and highlight a new resource that was mentioned earlier, the Bereavement Support Program. Next slide, please. We understand that experiencing a loss is one of life's most difficult moments, and we want to ensure our community feels supported during these times. Starting in 2026, Columbia is adding services from New York Life, including empathy and survivor support, to help employees and their families navigate both the practical and emotional aspects of loss. Both services aim to support beneficiaries after the death of a loved one, offering grief-related guidance and resources, which will be provided at no cost to you. On this slide, you'll see key unique highlights for both empathy and survivor support. Empathy is a digital app-based service and offers a self-service model available 24/7, which can be shared with up to 5 family members or friends. This gives users the ability to handle tasks digitally, such as closing accounts or creating an obituary. Continuous support is also available through a real-time chat feature with care managers. This allows you to navigate grief-related tasks at your own pace. For those who prefer hands-on support and guidance, Survivor Support provides direct contact with a dedicated human specialist. They will assist with complex processes such as funeral planning and insurance claims. Users can tap into community-driven resources, including grief camps for children. The specialist ensures personalized ongoing support, making the experience ideal for beneficiaries needing tailored assistance. Please note that you have access to both of these benefits. Next slide, please. We would now like to take this time to let you know that we are bringing back the in-person benefit expos and health screenings. Please join us at one of the events that are being held around campus, Thursday, November 6th at the Medical Center, Wednesday, November 12th at Lenfest, Manhattanville campus, and Thursday, November 13th at Lerner Hall, Morningside campus. You can check your blood pressure, cholesterol, and glucose levels. Fasting is recommended but not required for these procedures. There will be representatives from Columbia Human Resources, Columbia doctors, as well as benefit vendor partners for you to speak with. At CUIMC, there will be ergonomic assessments, acupuncture, upper body massages, and skincare screenings. And at the Morningside and Manhattanville locations, you can walk in to receive a free flu shot. Next slide, please. So open enrollment will begin on Monday, November 10th, and will end on Friday, November 21st. When making your elections, please remember to check out in cubes to complete your enrollment. Next slide. Now, if you have any questions, please submit them through the chat feature. If you cannot stay and have additional questions, please contact the Benefits Service Center at the information on this slide. We encourage you to visit our benefits website where you will find all of the information we have presented today and much more. And we thank you for joining today's session. And now I'll hand it over to Jose Feliciano, the benefits manager, and he'll help us navigate the chat for questions.
Thank you, Angela. This first question is to you, Lucia. It's a two-part question. They're asking, what is the name of the current provider for optional life insurance? And the second part of the question is, what does it mean reduce rates for this year?
Hi. So the current carrier for New York, sorry, for optional life is New York Life Insurance. The rates that you pay all depend on your age. So if you go onto the website, depending on what your age, uh, what category you fall in would give you what your rate is. So those rates will be reducing in 2026 by about 3%. Those are the rates that we are referring to.
Thank you, Lucy. I have a third question for you. This question is there a age cap for LTD for those 65 and over? Should or can they continue to enroll? Is there benefit after a certain age?
For long-term disability?
Yes.
It all depends when you go out on long-term disability. So, for example, we do have a certain time period in which you can receive payment for long-term disability. So, if you are, I have to look for it.
Actually, Lucia, I have that. I'm gonna go ahead and post it in the chat. It's I think Sarah mentioned it earlier, but it's the
Yeah,
age of date of
it's the
disability.
age.
So I just posted that information in the chat.
Oh, oh,
Thank
okay.
you, Angela. Angela, this question is for you, and the question is, um, uh, will you be sharing this PowerPoint? And a second part of the question is, I have not received the cost coverage information for my 2026 enrollment booklet. Where do I find this information?
So yes, this presentation and the slides will be presented or will be uploaded to our benefits website at humanresources.columbia.edu/OE. And you click on officers. We are currently still reviewing the rates for next year, but they will be posted on Monday, November 3rd, and we'll notify all benefits eligible employees when they are available, and we'll give you the direct link for the rates and information.
Thank you, Angela. I have another question for you, Angela, and the question is, what does an HSA account cover?
So HSA account is a health savings account, and it's coupled if you were enrolled in a high deductible plan, and they are eligible for out-of-pocket medical costs such as co-pays, deductibles, co-insurance, also dental, out-of-pocket dental insurance, claims or out-of-pocket dental costs, and vision.
Thank you, Angela. Here's another part to that question with the HSA. I thought you could roll over all of HSA.
Yes, for a health savings account, all of the funds roll over. If you're speaking about not being able to roll over funds, you're probably referring to the flexible spending account. There is a cap on how much you can roll over on unused funds for a healthcare spending account.
Okay, thank you, Angela. This next question is for you, Lucia. The question is Columbia still contributing 5,000 to the DCA?
Medicare
Or
flexible
is the
spending.
contribution changing as well?
And this is a great question. Yes, I did not cover it, and I apologize. But yes, there Columbia is still contributing $5,000 to dependent care flexible spending account. That is not changing.
Thank you, Lucia. There's another question regarding the DCFSA. What is the age limit on dependent care? My child will be turning 14 next month. Can I still claim her for this year since she is still 13?
For dependent care FSA,
Yes.
uh, the dependent children, it covers children under age 13 for children under the age of 13. And what was the second part of the question? Oh, the child turning 14. Yeah, so then the child will no longer be eligible for expenses at once they turn 14.
Thank you, Lucia. I have another question in regards to the child care benefit. The employee is asking, can the child care flexible account be used for summer camp?
Only during if it's a day summer camp, if they're going to um, summer camp during the day, but not sleepover, for example.
Angela, this question is for you. The question is, when do benefits re-up? I'm assuming they're saying, when do they restart?
So your benefits, most of your benefits will roll over, and any changes made during this time during open enrollment will be effective for January 1st, 2026.
This question is for you, Angela. The question is long-term care insurance offered?
Jose, I
Actually,
can jump in. I had
Thank
actually
you,
answered
thank you,
that
Lauren.
question.
Yeah,
Yeah, it's okay.
yeah.
So the long-term care insurance program is not currently offered. However, we are looking at a potentially enhanced program that we would do a special enrollment, most likely in the spring. So more information should be forthcoming in 2026 about that. Thanks.
Thank you, Lauren. Okay, this question is for you, Deborah. The question is, I will be 50 next year. Can I change my 401k or IRA? We have a 403b.
And for the 40, is this regarding the VRSP or the university retirement plan?
It's not clear on the question, but I'm assuming it's regarding the voluntary retirement plan, as they stated, the 401k, which we have a 403b.
If you are, to my understanding, based on your question, if you are age 50 and you wanted to make changes to your voluntary retirement savings plan, you can go onto Cubes and make that change throughout the year. So it's not just sectioned towards open enrollment, if that was what you were asking.
Angela, this is a question for you. The question is the legal benefit available this year?
Yes, the legal benefit is still available to be enrolled in for 2026.
Going through the questions, 1 second, please. Okay, this question is for you, Angela. The question is in regards to the dependent care FSA. So it sounds like Columbia University contributes 5,000 for the child care benefit. Can we add 2,500 on top of that?
Yes, so the child care benefit, there are some rules and criteria that you have to follow. It is for children under the age of 6, so 5 and under. And Columbia does contribute up to 5,000, and you are eligible to go ahead and contribute the additional 2,500. But if your child is over the age of 6, then you can go ahead and contribute the 7,500 in your dependent care spending account.
Okay, and Angela, if you can just direct them as to where they can make the election for an FSA.
Okay, that would be through Cubes. If you were to log in through Cubes on the benefits website, I can go ahead and link that for you.
Okay.
And just Jose, I just saw something else connected to that. It said if there was a married couple both working at Columbia, it would have, if you are doing your taxes together, it would be a combined 7,500. So it's not 7,500 for each of you, it's combined.
Thank you. Deborah, this question is for you. The question is Roth pre-tax for those making under 145,000.
It's for those making 145,000 plus. So if you are making 145,000 for the year of 2025, you will be considered, you're eligible for 2026.
Angela, Angela, there's another question regarding the DCFSA. Is Columbia contribution to the DCFSA for child care prorated in the year that the child ages out of eligibility?
Yes, so if you put in, let's just say if you put in 5,000 this year, but actually it will not prorate, but the services will have to be rendered by the time your child is 13.
Deborah, this question is for you. The question is, does the 457B need to be re-enrolled every year. The IRS limit for this is separate from the 403B limit.
Once you are enrolled in the 457 plan, you do not have to re-enroll. If you do want to make changes to your contribution percentage, you can go ahead and do that at open enrollment. Could you repeat the second part of that question, please?
They wanted to know the limit, the annual limit
Yes,
for the regular 403B.
my apologies. Yes. So the limit is it it is not the same as the 403B limit. They're two separate limits, even if the amount is the same.
Lucia, this question is for you. Someone is asking, can they use their dependent care for their grandson?
I do not believe you can use it for your grandson. There is a guideline that describes what a dependent is.
I believe if you
Trying to
have,
find that. It says, including a parent, spouse, child who is physically, mentally unable to care, so who qualifies as a tax dependent. So I'm not, what do you think, Angela?
it would be if you have legal guardianship over the child
Guardianship.
and the
Mhm.
court stated that you have guardianship or you are now the child's parent, even though they're your god's grandchild, you will be able to use it, the dependent care. But they have
Thank
to
you,
be court mandate, there have to be, you will have to submit court documentation that you are a legal guardian.
Thank you.
Angela and Lucia. The next question I'm going to throw at you, Angela. The question is regarding the HSA contributions. Can you confirm if, oh, hold on, it moved. Can you confirm if there is really a limit of how much can roll over each year? I was under the understanding this applies to FSA only and the HSA total rollover each year. If you can elaborate on there.
Yeah, that is correct. For the flexible spending account, there is a rollover limit. So for this year going into next year, you can roll over $660, but that will increase in 2026. Rolling over into 2027, it's going up to 680. But if you have a health savings account, all of your funds will roll over. There's no limit in the health savings account.
We have an employee, Angela, I'm gonna give this to you. They're basically asking, their dependent is changing their name legally. What process to update the coverage?
You would have to submit the court documentation that the name is legally changed, and we can update that for you in the system. And it will automatically be transferred to the vendors.
Thank you, Angela. The next question is for you, Deborah. The question is there a limit to how much you can contribute to your 403B?
Yes, so for the current year, 2025, the limit is 23,500. We do not yet have the limits for 2026 as of yet.
I just want to say that one of the slides it did say that there was an erroneous information about the HSA. There's a certain rollover. That's not correct. The rollover only pertains to the health care flexible spending account. The health savings account, the entire amount does roll over. So I apologize for that.
Thank you, Lucia. I can give you the next question, Lucia. The next question is, if you resign from Columbia University, what will happen to health savings account and flexible savings account? And you're on mute, Lucia.
Health savings account, sorry, is a portable account. So when you retire or resign, the monies roll over and you can use those, are yours and you're with Optum Bank, and you could use them to pay for any medical, dental, vision expenses, um, as opposed to the healthcare flexible spending account, which does not roll over. It does not continue to be available to you after you resign. You can, however, use the funds that are in your account prior to resigning, and you have 90 days to submit any uh, expenses incurred before your resignation to United Healthcare for reimbursement.
Lucia, there's a second part to that question, and that is, are there tax breaks with the HSA account funds when filing your income taxes?
That's a question that maybe would need to go to to your financial advisor. I do not know
So
the answer to
the,
a
the
tax
initial
break.
tax break, I could
Oh,
answer
I
some of
mean,
that.
oh, like pre-tax or post-tax?
Yeah, so it is
You're not,
pre-tax. So
oh,
it's
I'm
lessening your
sorry, yeah.
taxable gross at the time of your payroll deduction. So that is the tax break that you receive.
And you're not paying taxes on the contributions that you're contributing, and you're not paying taxes on the funds that you are,
Getting
uh,
reimbursed for.
yeah, taking out of your account. So you're not paying taxes at all. I'm sorry, yes, that's what.
Thank you, Lucia and Angela. Lucia, the next question is for next year. Does the optional term life insurance still cover a max of 6 times of your salary?
Yes, you can elect up to 6 times your annual salary, up to 1,750,000, including the basic 50,000 in 2026. However, in 2026, you'll be able to increase it by 3 times up to 1 million without evidence of insurability. So anything over that 1 million, you would need to submit evidence of insurability.
The next question is for you, Angela. The question is there a limit to rollover in the transit parking?
No, there is no limit to rollover. Your money will continue to roll over month after month, but we do encourage you to monitor what's in your account. Because you can only, if you have a large amount, it will be harder to spend it down. If you were to leave the university, you only have 90 days to submit for reimbursement, and it's during the time that you were an active employee here. So we do encourage you to monitor the funds in your account, although you can roll over month after month.
If you have additional questions, please add them to the chat.
I also see there's there's a Q&A feature, Jose, that I could look at. And Carla, this one's for you. Why doesn't PTS cover high school?
PTS is a benefit just for grades K through 8, per the policy. There was also a Bright Horizons question. I can answer that too. I saw that. The tuition programs has the college coach through Bright Horizons. That is geared towards high school students. They provide some great services such as helping them select colleges, essays, writing their college essays. You are eligible as a full-time or part-time officer. I know the Office of the Work Life, they do the backup care through Bright Horizons, which is a separate program. So if you have any questions on that portion of it, you contact the Office of the Work Life. But regarding the college coach, you can always contact us.
Thank you, Carla. I have another question for you regarding tuition, employee tuition reimbursement. What is the benefit for employees going back to school at Columbia? Any restrictions?
So it depends on what type of officer you are. You can always reach out to us and I can, look you up and let you know. But it's a 2-year waiting period. And depending on your officer status, it could be either at Columbia only or Columbia, Barnard, and Teachers College. Usually it's 2 courses per term, but some are just 1 per term. But again, if you send us an email at the hrbenefits@columbia.edu, it can get routed to me and I can look you up.
Thank you, Carla.
You're welcome.
I have another question for you, uh, uh, Angela. I'm having an I'm having an FSA account. My husband has an HSA account before we got married in the last year. Does getting married change the eligibility for the FSA?
Eligibility as to how much money you can put into the account. Again, if you're filing taxes together, it would affect that. What I would suggest is recommend speaking with your accountant to make sure that you are both in the correct accounts and you're contributing the appropriate amount.
Thank you, Angela. Lucia, this question is for you. The question is, my daughter turned 26 next year. Is she covered until the end of the year for medical insurance?
Medical coverage is available until the end of the month in which your daughter turns 26. Not until the end of the year, it's until the end of the month.
Thank you, Lucia. Deborah, this question is for you. What part of the voluntary retirement savings plan can be pre-tax? Only catch-up contribution or all?
Sorry. So for the voluntary retirement savings plan, you have the pre-tax option and you have the Roth option, and you can go ahead and contribute to both plans as an officer, as an employee of the university. If you are 50 plus and make 145K plus, then that is where it goes into the post-tax, the Roth option.
If you have any questions, please add them to the chat.
Deb, it says, I'm currently contributing 6% to my voluntary retirement savings plan and would like to know how much Columbia contributes to the retirement savings plan.
So Columbia University contributes based off of age and service. So it depends on how long you've been with the university and your age. Yeah. Could you provide your uni, and if I can look into that further for you.
Angela, I have another question for you. The question is, my kid has surgery scheduled for January. Would the medical coverage in 2026 be similar to the current plan?
Yes, our plans are not changing in 2026. So whichever plan you're enrolled in currently, and if you continue in that plan, the benefits still apply.
Okay, thank you, Angela. Deborah, I have another question. The question is the over 145K Roth automatic, or is that something we need to specify?
That is something that you would have to go ahead and make the change to. Let me look into that also, if you can also provide your uni.
Lucia, the next question is for you. This question is in regards to, I believe it's long-term. The person put LT, which I'm assuming is long-term disability. Can a LT insurance be converted to a whole life insurance policy?
You can convert your life insurance and your long-term disability insurance to an individual policy with New York Life when you resign from or you leave Columbia University or retire. If you retire, you could only convert your life insurance. It's an individual policy. I'm not certain if it's a whole life policy. That would be I could ask New York Life if that's considered a whole life policy. Because whole life policies are policies that stay with you for your entire lifetime, and also has cash value. And I know that our life insurance policies do not have cash value. So there's the definition of whole life. I don't believe it's the correct definition for the conversion. But I can certainly uh, I could certainly ask New York Life, to confirm that.
Um,
Thank you.
Jose, can I go back to that Roth question?
Yes, you can.
Okay, thank you. So anyone over the age of 50, 50 plus, and that makes the threshold of 145,000 plus, this is automatically enrolled. So just to confirm that this is an automatically enrolled plan that will happen with Roth if you are 50 plus and you make over 145 plus.
Thank you, Deborah. The next question is for you, Angela. And it's regarding the FSA. Please explain again what happens if I leave before the end of 2026. How much, if any, would I get back of the amount I designated?
For flexible spending account, the only way to get the money back, quote unquote, is to get reimbursed for services rendered while you were an employee here. So you can submit for reimbursement, but unfortunately, if you were to leave, you do not get the money back unless you have an eligible expense.
Thank you, Angela.
I see a question about a dependent who is disabled and will be turning 26 soon. What should you do to keep them on Columbia University healthcare insurance? Just wanted to let you know that you would have to apply through United Healthcare for an extension of coverage for medical, and if you'd like dental through Aetna. You can give us a call and we could provide the necessary documentation for you to submit to United Healthcare.
Thank you, Lucia. Deborah, I have a question for you. What is the maximum percentage that Columbia University will match for the retiree plan contribution
And that is 3%.
for those who are eligible?
Yes, thank you.
Angela, this is a quick question. An employee is asking, when will the 2026 benefit be posted, the costs?
It will be posted on November 3rd, and you'll receive an email notification with a link directing you to the exact page where you could view those rates.
Okay, thank you.
I do see, sorry, under the other chat, under dental plan, what is the meaning of orthodontic lifetime maximum? So that just means that there is a finite dollar amount. So if you were to use the orthodontia benefit, it does not renew over every year like the other benefits. So if you're going specifically for braces or orthodontia care, the exact amount that you spend, that is the lifetime limit that you'll get. Whereas if you go for cleanings or fillings or anything like that, that money restarts at the top of every year, whereas orthodontia, it does not.
Thank you, Angela. Deborah, this question is for you, and the employee's asking, can I merge my TIAA account for my contributions when I was support staff? I'm now an officer. TIAA has two separate accounts.
They cannot merge it. They're two separate accounts, and they stay two separate accounts.
I see a question that says, I just had a baby last month. Would I get a full 5K FSA this year? The dependent, this is for the dependent care FSA. The dependent care FSA is prorated, so it depends on when you enroll. So you will not be getting the full amount. Next year you will be, if you continue to be eligible, the full $5,000.
Actually, no, for dependent care, if they're contributing, you can actually receive up the entire amount, but you just want to be careful if you were to enroll in that
Oh,
now,
I was
because
thinking
it is
childcare
divided by how many pay periods are left. However, for childcare benefit, which what Lucia was referring to, which is a Columbia contribution, that is prorated. But if you wanted to, you can enroll in the dependent care flexible spending account. But again, it will just be divided by however many paychecks are left. So if you were to enroll in 5,000 this year, we only have about 4 paychecks left, I believe. So it'll be divided evenly.
Thank you, Angela.
Thank you,
Uh,
Angela. Carla, there's a question for you. It says, is primary tuition scholarship reduced by financial aid?
The primary tuition scholarship, it's based on, let me go to the, typically it's based on your income. 60,000 or above, it's 10%. And then we have a chart on the website. If it's below that, what percentage it would be. You do need to submit your previous year income tax to show the proof of the income. But if it's 60,000 or above, the default is 10%. Also, if you don't provide previous year tax returns, the default is also 10%. That's for New York City private schools. The school at Columbia, that's different. For the school at Columbia, it's 60% for the first child, 65% for any siblings. No previous tax returns needed for that.
Thank you, Carla.
You're welcome.
Deborah, I have a two-part question, and the question is, how do I enroll in the retirement plan if not auto-enrolled? And the second part is there a Roth option with the 403B?
The way that you would go ahead and enroll in the retirement plan is through your cubes in retirement. And if there is say it again, I'm sorry, the second part?
The second part is there a Roth option on the
Yes,
403B?
there is a Roth option. When you go into Cubes and go to the retirement section of Cubes, you will see the pre-tax option and you will see the post-tax option, and you can make the decision if you want to do both or one or the other.
Thank you, Deborah. The next question for you, Lucia. The question is, for dental benefits, are crowns and implants included in the lifetime max?
I know that crowns. Oh, who's going to answer?
Oh, go ahead, Lucia, if you want.
Oh, they're they are probably under major restorative care, and depending on what network you're using, if you're using a dentist in the in-network with Aetna or Columbia, the amount that is paid is 50% of the cost or 60%. And the maximum benefit per year is $1,500 for those types of services. Orthodontia is completely separate from that. And orthodontia has a separate lifetime, a maximum lifetime amount. That's separate from your basic restorative or major restorative services under the dental plan.
Thank you, Lucia. The next question is for you, Carla. The question is PTS and financial aid. If your child receives awards and scholarships from other sources, the amount of the PTS will not be affected, except that the PTS amount will be capped at your actual.
I think that was just a response that Pete posted for
Someone
everyone,
responded.
which is
Okay.
excellent.
Thank you. Thank
Thank you,
you.
Pete.
Thank you. Angela, I have another question for you, and this is in regards to the DCFSA. So if I enroll in the Columbia-sponsored childcare benefits for 5,000 for my son next year, but he's turned 6 in February, the 21st, does that mean exactly? Does it only cover expenses incurred after school programs between January and February 21st? It says like I spend, the CU sponsor 5,000 during January, or can I spend it on the summer camp in 2026 if I pay for them in January and it's over 5,000?
I'm gonna take this question back because it's a
Sure.
lot of separate parts, so I want to make sure that I'm answering your question specifically. So I do see your name here, and I will take that back and get back to you.
Thank you, Angela. I don't see any. If you have any questions, please add them to the chat.
There's one about tuition, Carla. I lost it, but our university, does child college tuition benefit cover universities in Canada or other countries? I believe you may or may not have touched on this.
Yeah, we do. It does cover international schools. It has to be an accredited school. But it covers that and it covers study abroad. If you need more information, you can definitely reach out to tuition programs, but it does.
There's another question. It says, when can we start submitting tuition payment for spring of 2026?
As soon as you get that invoice, you can start submitting it.
Yeah,
So for the fall, we usually tell everyone to wait until July 1st. But for the spring and the summer, as soon as you start getting those school invoices, you can start submitting them.
thank you.
You're welcome.
Just a quick time check. We have about 4 more minutes. So again, you can continue asking questions, or if you would like to email us, hrbenefits@columbia.edu, or you can call our service center, 212-851-7000. But again, just a quick time check for a few more minutes.
Just a quick question to you, Deborah. The question is, when do you become eligible to enroll in retirement program?
For the VRSP, that is an automatically enrolled program for officers. This is usually after 6 months, and you have the option to opt out if you choose not to enroll in it. But the 403B VRSP plan, Voluntary Retirement Savings Plan, this is an auto enroll plan for officers.
Carla, thank you, Deborah. Carla, this question is for you. How many terms is a dependent covered for college tuition reimbursement? Carla, you're on mute.
Yep, I just realized that it's 8 semesters. If they're in a school where it's trimesters or there's 4 semesters, it's the equivalent of, but it's 8 semesters, which is 4 years.
Hi, I just want to take myself off of mute for 1 second. Sorry. Sarah Luke, Executive Director of Benefits. Hi. I know there was about 2 or 3 questions in the Q&A portion about retiree benefits, asking us to speak briefly about that. So I can speak to the health and welfare benefits for retired officers. So retired officers are eligible to continue medical coverage through the exchange marketplace. So Columbia University provides access to the exchange through a program called Via Benefits. And then they provide a subsidy amount in the form of a health reimbursement account to offset some of those costs. The amount of that health reimbursement account for 2026 is increasing to $2,100 per retiree. And then an eligible spouse, if that's retiree also has an eligible spouse in 2026, will receive half of that amount, which is $1,050. There's also benefits related to tuition and also information on retirement that could be applicable as well. But I just wanted to at least give that highlight about the change to the HRA amount for 2026.
Thank you, Sarah. Angela, I throw it back at you. We are at the hour.
Yes, so again, thank you for joining today. We are sorry if we were not able to get to all of the questions. They were excellent questions. So please feel free to email us those questions at hrbenefits@columbia.edu. And again, this presentation and the information will be provided on our officers' website, humanresources.columbia.edu/OE. So again, thank you, everyone, and have a great day.
Thank you.